Hey, welcome back. Well, cold and flu season is upon us, and a new vote by a Centers for Disease Control panel may make it more of a challenge for some Americans to get the COVID vaccine. The newly appointed Prevention Advisory Panel is recommending people 65 and older and those with underlying health conditions get the shot. For everyone else, the recommendation is to make that decision with your doctor. So the guidance still needs to be cleared by the acting CDC director, but some are concerned that if approved, it could lead to confusion over who is eligible and whether or not insurance will cover the costs. Joining us now is vascular surgeon and founder of Healthcare for Action, Dr. Anahita Dua. Doctor, wonderful to have you on the program this morning. You know, I wanted to start focusing solely on the guidance for COVID vaccines. Obviously, this is a much newer vaccine, shorter history. You agree with that this new guidance is going to impact cost and availability. What do you see as the resulting impact of that prediction then as well?
I think the fundamental resulting impact is going to be that there are going to be people that need the vaccine that are unable to get it. Cost and access to care is a fundamental problem across the United States in any healthcare realm. And if you add barriers, like, for example, saying that there's confusion about who gets the vaccine and when, you need to talk to your doctor. Basic economics is going to say that certain places that stock the vaccine, for example, are going to say, well, we're not going to stock it until we see what the demand is going to be. And so what that means is for the patient that has a particular disease who needs to get the vaccine today, they may not be able to just walk into Walgreens and CVS and ask for it because it's no longer available, which means less people get vaccinated and more people get sick.
Right, and there's concern that the vaccine causes some adverse effects. We've heard of them. You've also said you have no problem with scrutinizing data, asking questions. Even if one person has died or had an extremely adverse reaction, I think we can all agree it's worth investigating why. We've had some years with the COVID data now. How do we get answers here about correlation? Take a look at these reports of adverse effects, put them into context, and make an assessment.
That's a great question. And that is really the fundamental basis of science. I completely agree that you need to scrutinize, and absolutely, one death is one death too many. And with all of these medications, all the drugs, actually, there are very stringent guidelines about what types of adverse reactions need to prompt further review. And correlation and causation, as you brought up, are exactly the main point, because unfortunately, the number of patients that get the vaccine are over hundreds of thousands. And so as a result, that means that all of these people who are leading different types of lives are going to have different variables that go into the pot. So the way in which you answer this question is you actually take all the patients that got the vaccine and patients who didn't get the vaccine, and you compare. Now, it would be unethical to do that type of randomized control trial currently, because we know, based on the data that we already have, that this vaccine is safe, and that patients who have adverse reactions in very small amounts. And the most important thing, therefore, is informed consent. Telling the patients that these are the types of things that could happen to you, but if you don't take the vaccine and you get COVID, then these are the things that could happen. And actually, as a vascular surgeon, I dealt specifically with a type of adverse reaction, which is blood clots. If you remember, during COVID, blood clots were a huge deal. We didn't know in the beginning, but that was something that I dealt with personally, people getting blood clots in the legs. Now, if you get the vaccine, is it possible that you have a slightly higher risk? And again, possible, we don't know. Is it possible? Yes. But if you get COVID, your risk of getting a blood clot is significantly higher. Therefore, the vaccine is the right thing to do. And that's the way in which we approach whether or not you should get the vaccine.
Well, I certainly wish we had more time. I've got about a million questions for you. Dr. Dua, really appreciate your time. Thank you very much.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.